The commonest reason for IVF failure is poor quality embryos, and the commonest reason for poor quality embryos is a poor quality IVF lab. The trouble is that patients aren't even aware that their embryos are of poor quality, and this is one of IVF's dirty little secrets today, that most IVF clinics in India aren't capable of creating good quality embryos. They hide this fact by refusing to share information with patients, by hiding the medical records, and not providing photographs of their embryos to their patients. They don't want to provide tangible documentary evidence of their incompetence, and what makes our blood boil is that they can get away with this arrogance and incompetence because patients aren't assertive enough to demand their legal rights and ask for their own medical records. They have a legal right to these, and it's illegal on the doctor's part to hide these. But IVF doctors can merrily continue getting away with cheating patients on a regular basis because patients are so poorly informed and they trust their doctors blindly. This can be an expensive error. When the IVF cycle fails, instead of accepting responsibility for this, the IVF doctor adds insult to injury by blaming the failure on the patient's poor egg quality or a thin uterine lining, facts that they cook up after the fact to save their own skin. The poor patient doesn't know any better and is forced to accept whatever explanation the IVF clinic gives for the failed implantation. This is why they get taken for a ride. Even worse, this kind of malpractice harms the reputation of all IVF clinics because once a patient has burnt their fingers at one IVF clinic, they are very reluctant to trust any other IVF doctor or take treatment from any other IVF clinic, no matter how good it is. They have had one bad experience already, and they aren't sophisticated enough to be able to differentiate between a good IVF clinic and a bad IVF clinic. This is why you need to do your homework in advance before starting your IVF cycle.